Well, joining us now is Africa 54 health correspondent Linord Moudou. And what do you have for us today, Linord?
The World Health Organization says violence against women is a major public health problem and can negatively affect women's physical and mental health. Medical experts and advocates say more needs to be done to protect women and girls globally, particularly in developing countries where victims are not empowered to speak up, and many cases remain unreported. I sat down with Dr. Dsane-Aidoo, head of clinical services at Kasoa Polyclinic in Ghana, to discuss his research on the subject and what is being done to address it in Ghana.
So sexual violence generally is said to be any form of harassment, from verbal to even forceful penetration, genital penetration. In Africa, there is no concrete statistics studying to show the extent and the magnitude of that problem. In fact, the only time that it came to the attention, worldwide attention, was when in DRC Congo it was being used as a weapon of war. But now, even more than ever, beyond that, I think that it's become a social epidemic. I mean, to the point that it has now come to stay with us. And in Ghana, it's a big one. I made a rare observation that in a week, I can have like 2 girls brought in, 3, sometimes in a week, you can have about 5 girls brought in with a complaint of alleged rape and alleged sexual violence.
Tell us about why it was so important to bring this issue forward.
When I was taking this up, I was looking at how this was going to affect them medically, the children medically, and how it was going to affect the families psychologically. And yet, along the line, we started making some interesting discoveries that we had actually not even considered.
Such as?
The interest of the parents. We found out that up to 50% of those girls never spoke to their parents or their guardians because they were scared of how they are going to react. The parents will end up beating up the children, telling them they are bad girls. And that is a serious thing because girls have been made to bear the costs of the defects of their sexuality. And although they are the victims, they are again victimized by their families for talking. And so the only time that the parents found out that these girls had a problem was when they had very bad infections or they were pregnant.
A research by the CDC says that over 80% of perpetrators are close to the victim, which means it is somebody in their circle.
That was supported by our research. We also discovered that 80%, exactly 80% of people are close. And so that idea that a rapist is a distant person, is a stranger, is really flawed. In fact, teachers in the home, uncles and family friends and neighbors, a big one, they are being abused in the religious places of worship, churches, mosques, shrines. All of these are people close to the family, people that have been trusted by the parents, have been trusted by these girls. We observed 2 levels of psychology that rapists use. There's the first psychology, which is the rapist who wants to hurt the victim. So he breaks into the house, gets a girl, rapes her, leaves her traumatized and in pain, or as part of an armed robbery, they rape the child. And then we have the lover psychology. They establish some intimate connection to the child. That is what will cause it to progress for a very long time. And so we have cases where the child has been abused for over a year, and yet the mother does not know. And this usually happens with the close people.
So tell us about some of the consequences that you're seeing physically, but also psychologically.
Some major degree psychological defects, i.e. poor eating habits, disordered human relationships. Some of the children either become very rude or very, very withdrawn from society, nightmares, all varied levels of depression, post-traumatic stress disorders, and so we've had all these issues. Another big one is the physical effects, the medical effects. I mean, that's what we're actually focusing on, and so we had other issues coming up.
What is being done, at least in your country, what is being done to the perpetrators?
At best, the rapist is jailed. And then the question comes to mind, what happens to the girl?
That was my next question.
They are left to go back to the communities. there's not a structured system to really get these girls well integrated into their communities, back into school. Locally, we had to now adopt, new ways of engaging these girls and counseling them in our own units. And that's what we're trying to do. We are hoping that we can actually have well-built rehabilitation centers where we can engage these girls, and help them psychologically. And we've had that. I mean, we have had some successes. Some of them who struggled with school, couldn't concentrate to study and all, and some who thought of even harming themselves. That's one of the big side effects, suicides and all. And over time, they've recovered. But it has to be a long follow-up, because there are relapses, and they'll be there, and all of a sudden these thoughts come back. They have flashbacks. We are hoping that we can have, these establishments. And in our own small way, we are trying, but it's still not good enough. Another thing too is the follow-ups. These girls have to be screened for all kinds of diseases, hepatitis, HIV, hepatitis C, and all. And sometimes they don't even have the money. We hope that we can reach out to policymakers so that our health insurance could at least have some cover for these girls as far as their medical care and their examinations are concerned.